Good night, everybody. Let me see, it's 8 and 4, well, 8 and 5, let's say. Would you like to start now, or would you prefer to wait for a little bit for your classmates? It's your choice. Hello? Is anybody in there? Hello?
Teacher, 5 minutes more.
5 minutes. 8 and 10, so we can start without any trouble, okay?
Okay, teacher. Okay, but one question. Where can we see all the recorded classes?
We have the link to get into YouTube in the WhatsApp description.
Oh, I can see it. Let me verify, please.
Okay, you open the WhatsApp group, and into the description, when you get into the logo, there is a link to go to YouTube.
Okay, thank you.
Okay. So let's see in 5 minutes. I'll be back. Okay, can you see my screen? Can you watch it?
Yes.
Okay, let's start. Today is not a very long presentation. We are going to check lots of details according to the last theoretical class. And for having all the information in order to complete the homework file, I sent you this presentation last week in order to check details to study, okay? And the ones who get into the previous workshop, well, I told them which slides are the most important. That's why it's important to get into this activity, because I organize the activities we are going to check. Well, let's go ahead. Today, I got a flu, so if you don't understand me very well while talking, with the complete confidence, turn on your microphone and tell me I can understand, or send a message in order to repeat the detail I'm telling, okay? Today we are going to talk about education and training. We are going to evaluate a general view about hospitals, about primary care, medical education, I mean the process about becoming a doctor, and then how to become a specialist in different countries. And very small detail about the overseas doctor, okay? When we talk about hospitals, we must consider this definition. A hospital is an institution that is built, staffed, and equipped for the diagnosis of disease, for the treatment, both medical and surgical, of the sick and the injured, and for their housing during this process. I mean, we all know that this is the institution when we can receive the correct treatment and care according to the situation. And of course, according to the situation is the period that you last into the hospital. This is a very common example about the hospital, when you can watch different services, different specialties maybe, or details to consider. For example, surgery is a very specific block, medical imaging another one, women's center another one, the emergency and urgent care is a big one, very easy to get into there. All hospitals, no matter the place, have a similar distribution when they have the chance to organize the priorities according to the epidemiological situation that they have in their country. So let's take this detail in account, because it's not a general rule how it should be organized. That's the way that every country or the one who's building it decides how to make it. But of course, they have general rules. For example, the first access for emergency rooms, then because they have to be so close, surgical theaters, then intensive care units, then become delivery and parturition rooms, then intensive care unit for children, for babies, right? Closer to the emergency room, the laboratory tests and imaging tests. So let's consider this. It's a way to do it. This slide, in my opinion, is important because it's showing you the detail that we are talking almost all the time. Abbreviations. Of course, abbreviations into the medical, into the hospital are important because they help us to catch the meaning easily and go faster to the place we are looking for. For example, surgery, laboratory, obstetrics and gynecology, orthopedics. And then we have how it works, how it's organized according to the place. And usually the room that you are at the moment. It's in red, maybe white, well, who knows, but it's easy to catch which place you are. Consider this for practicing, and it's gonna be easier, okay? Some important meanings. This slide is very important at this point because you have the chance to realize some concepts and specific words that are easy at the moment, that are possible. Okay, can you hear me? Okay, I corrected it. Okay, again, these concepts, these words are showing us the important detail about the specific classifications, we can say, how to call a patient, specific words that we use for describing the status of a patient into the hospital or into the medical attendance. For example, outpatients, people who come to the hospital to attend a clinic or to have a test or treatment, and then when they are finished, they go back home at the same day. I mean, they don't stay in the hospital, they don't have any situation to get admitted into the hospital. So they finish the process. They are well, the process, the reason they were to the hospital, and they go back, maybe for receiving a shot, or maybe for taking some oxygen or some medication with the oxygen, or maybe have an appointment, a medical appointment. I mean, all of these activities finish and they go back home. The inpatients, people who stay in the hospital for 1 or more days in order to receive treatment. They stay are called wards. So we were talking about wards, you know about it. Wards in the emergency room was that bed that has curtains surrounding and it's a little bit private. Into the hospital, when a patient is admitted, every room is a ward. Could be single rooms or single wards, or could be full wards, I mean with more people. In case there are 2 or more patients in a ward, in a room, they again use curtains to divide the space, to divide the place, and then get a little bit more private when the doctor is going to evaluate the patient again. So, you know, inpatients, people who stay into the hospital. Admitted patients, the way to get admitted into the hospital usually is by 3 ways. I mean, put on a waiting list, patients that can wait the treatment as they need. I mean, patients that are not in emergency, that don't really need to receive a solution now, well, they can wait. For example, umbilical hernia, right? If there's no complications, they can wait for a program they can get in the best physical conditions with great lab tests, and then the surgery can be developed without having less risk. I mean, avoiding problems. Then we have the telephone admissions that are usually, well, that are very common in different countries. For example, USA and UK, because this information is coming from there. Telephone admissions, people who are acutely ill, I mean, people who go to the hospital and explain the situation. So hospitals send an ambulance, pick up the patient and get back to the hospital to be admitted at the moment without waiting for. Could be, for example, I don't know, a trauma patient patient who had an accident, has a broken leg, for example, or a patient who's suffering, I don't know, any problem at the central nervous system, for example, ACV, for example, acute an accident cerebrovascular, right? So considering this, the telephone admissions is a way to consider to evaluate the situation according to a test, to some questions that the one that is attending the phone has to ask for. So that person is trained in this activity and doesn't have to make a mistake because there are resources, there are money that is inside. Another way, patients that are seen in the emergency, accident and emergency department. The doctor on duty arranges the admission if necessary. I mean, patient goes to the hospital, gets into the emergency room, and if the doctor that is on duty decides that this patient needs to get admitted, well, he makes everything for doing for going on with this detail. Could be, for example, dehydration, could be non-controlled diabetes, non-controlled hypertension. Well, we know many situations for getting admitted into the hospital. When you are into the hospital, complete your treatment, and you recover properly, you are discharged. I mean, after treatment, patients go back to their GP's care. They go back home, and the general practitioner into the community is the one who has to take care of you, to make the controls, and if something is wrong and considered necessary to send you again to the hospital, you have to go. This way of organization is, in my opinion, useful if people is well trained and if community has the culture, the education to use it properly. So it's a good way to start in this and to make it as an idea. I think it's a good way to work on. Let's go. When we talk about health service, we consider that all the institutions that give medical treatment and care, could be public or particular, are health service, okay? All of these institutions have the chance to organize their own protocols, their own way to organize their hospital, so it's properly to do it. Very common, very useful. So it's a way, of course, according to the situation, if it's public or it's private, you consider that the difference in resources, in medication, in pills, and as fast as you can receive the proper treatment or studies at the moment. Like or not, there is a difference, right? This is just an example how the healthcare system organizational structure works in USA. Why I'm showing you this? Because it's a way to compare how they are focused on investigation, on complete the proper process of investigate, but they don't do it with all of the population. They go to specific groups of people. For example, they are divided in 3 huge branches: scientific healthcare subsystem, complementary alternative healthcare subsystem, and popular healthcare subsystem. Both of them, complementary and popular, are going to people with less resources, people that government is supporting hospitals, and of course they don't have all the specialties and they have all the details that could have in places that certainly give more data for investigation. The scientific healthcare subsystem is focused on investigation. I mean, they, according how the hospital works, they receive an average. This average is qualified, and according to that, you could be a response center, first level, second level, third or fourth or sixth, and you become into a list. If the first response center is fulfilled, then they go to the second, then the third, then the fourth, and until finishing the whole list. And if you are the first and the second response center, you can maintain this place. You receive more resources from government, more money for investigation. You get all the time get more technological devices for improving the attendance, or you receive more support for studying according your branch. The scientific is divided in personal healthcare sector and population healthcare sector. The personal is for doctors, just the medical staff, people who work into the hospital, nurses, lab technicians, paramedics, well, everybody who's part of this staff in general gets into this, and they are not into the research. If they become into research, is under specific situations, specific details that we certainly look for. Then the second branch is population healthcare sector. The population healthcare sector is the one that is really focused on research, because they create the protocols that almost all around the world are useful, right? For example, the public health agencies, local, state, and federal, well, they give attendance to population, usually homeless, without taking money. That's why the resources they receive could be from local government or federal government. Then you have private health agencies. There are agencies that sell the insurance, the health insurance, and according to the money you give is how available this branches are allowed for you. And voluntary health agencies are hospitals that receive resources, not as the public or private, but they receive this in order to maintain these activities and receive voluntary help. I mean, they have medical staff, and if you want to go and help, you are free for doing that. Of course, they evaluate your curriculum, they evaluate all your studies, and according to that, you are into or not. You have to be clear on this. If it's voluntary, maybe you are not going to receive a payment, salary, okay? This is just for information. Slide for catching vocabulary is from the World Health Organization. When we check with the statistics how the healthcare system in USA works, that's where you check this for catching an idea how it works. Okay? Then we have, okay, healthcare in Bolivia. In Bolivia, of course, is a very different country from the way our governments work. We are divided into departments, and every department has a government, a gobernación, and every gobernación has a sedes, a specific office, we can say, when you receive part of the organization. The Ministry of Health and Sports have the huge responsibility about the medical attendance, but for not being just the only one who gives this information, they divide activities with sedes, and they give specific responsibilities to the departmental government, to the gobernación, right? The departmental government are the ones who are responsible for providing resources to health networks, and of course, work in coordination with SEDES, and SEDES, we can say, is the boss of municipal health social councils. These councils work hand by hand with municipal governments. All of them work in a hospital that is into the community, and well, you know how it works. The SEDES is responsible for the SAFSI program and Mi Salud teams. I mean, Ministry of Health also works with them, and they are trying to insert a new organization. Okay. Okay, this is just an example. And then we have again the healthcare system in Bolivia from the World Health Organization, giving us some statistics for considering. If we compare the previous organizations to the actual one, it's becoming better, but well, patience. It's at this point, it really needs changes. About primary care, again, we have important meanings. We know general practitioner, we will check in there, so it's clear. To make a referral or to refer a patient is when you send the patient to a specialist in the secondary care. Okay, if it's really needed, you don't say a patient because of yes. You really need a basis. You need a clinical criteria to refer a patient to another one, to a specialist, right? Then we have home visits, is to visit a patient at home as an appointment. It works, for example, in UK, in Cuba, doctors have a list of how many families they are responsible for. Every family could have maybe an elderly or maybe someone with, well, I don't know, with disabilities. And for not moving these fragile patients, we can say, they make appointments and they go to their home and make the evaluation. For example, husbands are people who are unable to leave their house, could be elderly, could be people that is in care about a patient with different capabilities, and it's not possible to go, or patients that are too ill and cannot go alone. They make a phone call and the doctors go to their home. That's why home visits is a way to organize and divide the job. Doctors go to the patient's home. That's the idea, not the inverse, okay? Doctor and the nurse goes. As you know, when we're checking the class about nursing, we had a specific branch of nurses that they go to visit patients, they go to make evaluations, and they consider how to continue treatment. For example, if they see a complication, they call the doctor or send the patient to a hospital. That's why it's important, this. Then we have out of hours treatment, the OOH. It's a specifically for UK. It's a well, it's a organization in the primary care. When, for example, how can I say that? We got some consultory rooms in the community. Some places, well, some houses could be when you have your consultation room, the place to receive patients, and then every doctor that is there in charge has a chance to go and make a shift into the hospital or being a support, right? The out of hours treatment is the organization that all the doctors in the community have, and they go to the hospital, make their shift, and then go back. The periods when they are no in the community, the day they are on shift, the patients have the chance to go to another consulting room or just wait to the doctor is because of their decision. I don't know if it's clear. Out of hours treatment, I mean, they are not working into their specific schedule. They change it in order to go and make shifts into the hospital to be better. The locum is the one who organizes the shifts, is the doctor that is responsible for these shifts. And he has to be so clear. This doctor has to be focused that if one of the colleagues cannot go to the shift and there is no way to cover this space, this one has to go and make the shift. He has to be free all the time. Covering the shift of a group, someone is absent. I mean, you cannot leave the shift into the hospital, right? If the community doctor cannot go, the general practitioner cannot go, the locum goes and takes its place. Well, district nurses, we were checking this. Nurses that visit temporarily husband patients or discharge patients, hospital patients for non-complicated procedures. For example, I don't know, a surgery, appendectomy could be an example, it's non-complicated. Or could be a fracture that is recovering well, but the district nurse goes and evaluates if there's a sign in complications, but details like that. The change dressings, I mean, is an activity usually developed by nurses, not auxiliaries, just nurses. When they change bandages from wounds, okay, such as also dressings. According to the situation, they can do it by their own, and it's perfect. It's a way to work. The midwife, we know, there's a trained staff who take care of antenatal patients. I mean, who follows all the process of the pregnancy, and when the delivery is close, they have the chance to send to refer the patient to a hospital, or if the baby is born at the moment, they are well trained to receive this parturition, to control the situation, okay? The health visitors, again, trained staff that are nurses that visit families to carry out checkups on young children under 5 to make sure they are healthy. I mean, they go home, they evaluate children, and if they see that something is not okay, I mean, they are not gaining enough weight, or maybe they are sick or have skin lesions, the health visitor has the chance to send this kid to the doctor and to the general practitioner, and then the general practitioner takes the next step. Health visitors are not the same as district nurses. District nurses go to specific patients and control a situation for a period of time. Health visitors go home by home, evaluating and looking for patients. Okay? According to the list, the doctor and the nurse have at home and know how many families are under their care. They have the chance to control the birth rate, or to control how many pregnant women they have at the moment, how many babies they are expecting for, how many elderly people are at the moment. So they can organize the population and go into statistics. It's easy, and it's a very nice activity. About medical education, I mean, it's a very interesting process. because in almost all around the world, medical career takes 6 years. I mean, 5 years as a student, as a fact, when you have to read books as if you were crazy, you have to make practice, you have to prepare speeches, okay? That's the undergraduate education, usually 5 years at medical school, the section of a university responsible for medical education, right? So you have the chance to collect all the information as much as you can during these 5 years, with short periods in practice, but that's the way it works. In UK, you have all of these grades, but they are not a focus, it's just extra information. For example, you are a core 1 to 3 years, where these medical studies are focused on learn about problem-based learning. I mean, they give you medical situations, medical cases, and you start thinking. You are learning how to think, how to investigate, how to collect information. And it's a very nice process. Then you become student selected modules. I mean, you choose specific materials, specific topics to study as extra time, and you become better, but it's your choice according to the things you certainly like. Then you have vocational studies and clinical skills. These vocational studies, well, they prepare you for getting into patients with all of the terms. I mean, they show you psychology topics, psychology tips. They show you how to get in the great rapport with a patient. And well, of course, clinical skills, how to change dressings, how to collect and organize information, how to start making the medical report. Well, you know how it works. And then clinical attachments, 4 and 5 years. When you have a specific topics to go ahead, I mean, internal medicine, surgery, psychological medicine, pediatrics and obstetrics and gynecology, and general practice. In UK, USA, general practice is a great point of view. I mean, great, because when you become a general practitioner, you are checking, maybe in a superficial way, many branches. You have the chance to evaluate many situations, and if you consider necessary, you send the patient to the specialist. When you become a specialist, you are an expert for a specific branch, for specific details, and through the time, you tend to forget general activity. It's normal, it happens, it's a very common situation, right? The graduation is reached when you finish the rotating internship. I mean, that year when you go to the principal branches in medicine and you have the chance to practice and give all the information you have. I mean, internal medicine, surgery, pediatrics, pediatrics, obstetrics and gynecology, sometimes emergency, and the public health. With all of these capabilities, all of these activities done, you get graduated. Well, this is just a joke when you evaluate the electivity, how happy you are and how it works. It's just a joke. But now, when you finish medical school, you became graduate. You know that you don't have to get just in this place. You have to go ahead. You have to continue studying. And you become a postgraduate. You prepare your registration. Usually the new doctor goes to the rural area and they start working and start catching experience in job. Okay. when you are a postgraduate, as I was telling you, you don't have to stay there. You know you have to go ahead. Maybe you have an idea what you certainly want to do. And then that's why it comes in this way. You become a continuing professional development. You don't have to finish studying. When we are doctors, we know that every day we have to read something. It's like a custom. We cannot avoid the information. We cannot avoid the reality that medicine is changing all the time by giant steps, and we cannot lose this information. According to the branch you like, the branch you feel better, you make your best, you can start making programs like this, programs for the American Heart Association. They support your studies and jobs all around the world. The American Heart Association is the result of research in the healthcare system. So that's why it's important to consider that they give us these protocols in order to improve our job and reduce mortality in patients. Again, the fundamental critical care systems, and well, all of these courses from pediatrics, the fundamental critical care support in pregnancy. Well, there are very great programs, the International Trauma Life Support. Well, all of them are international. You have the chance to do them in your country. Maybe you have this opportunity. So take them if you consider they are for you. If it's not your brand, well, you are not going to enjoy it and it's going to be so hard. We all know about it. Okay, you got your registration, you went to rural area, then you continue studying, and now is the time to choose a specialty. In UK and USA, there are programs that support you to become a specialist. Programs that are giving you the chance to continue studying and working at the same time, receiving a payment, having all the advantages we can say. I mean, healthcare, health insurance, well, the correct salary, the correct payment. And this foundation program is a way that you get into this new world, we can say. The foundation is a 2-year training program. I mean, you take 2 years for catching more capabilities that are focused to your specialty. Okay, they are the bridge between university level study at medical school and specialist or general practice training. In England, in UK, for example, you finish the school, you get graduated, you have the chance to continue with the foundation program. You practice 2 years. If you decide to become a GP, well, the foundation is showing you the GP activities, is supporting this part. If you want to become, for example, a surgeon, all activities are focused on surgery branches, on surgical branches, I'm sorry. So let's consider this. In the foundation, well, these 2 years are a series of placements. Each one lasts 4 months around, could be less or more. And you can become the junior doctor, that is the trainee. To sample different specialties, for example, pediatrics, right? To say you become a trainee in the branch you are preparing, you are getting prepared. In the first year, you are the 1-year trainee. In the second year trainee. Why trainee? Because you are, it becomes from trainer. You are the trainee, you are el entrenado, right? You are catching capability. Each trainee has an educational supervisor who ensures that more senior doctors deliver training in different ways, including medical and educational supervision. I mean, this educational supervisor ensures that you are receiving the correct information, you are practicing properly. Of course, you have some goals to catch, and according to that goals, they evaluate your development, your how you certainly show clinical competences. Of course, you must demonstrate all of the competences. And well, if you don't do that, you are losing this opportunity, okay? This just is an example how first year and second year training works. So you can see that in placements counting for general surgery, placements containing for medical medicine, and alternative placements. Only emergencies mandatory in FD2 in the second year training. You go to all of these medical branches and you have the chance to practice everywhere. Talking about people in medical education, well, so what's the name? You have supervisor. But certainly this is the complete hierarchy according to the process of being a trainee, to being the foundation program. You got a tutor, someone that leads the tutorials for all the trainees, okay? The demonstrator is a doctor that goes to a specific class and show how to make a process, how to develop an activity. The lecturer or senior lecturer is the one who shows how to write down, how to research responsibilities for teaching, or who prepares you in a very disciplined way in order to catch the objectives, of course, following investigation and writing down. The professor is a senior with teaching and research responsibilities for a particular discipline, for example, surgery or dermatology or who knows, right? The professor is the one who leads the team, and this team collects the information, and the professor with the team evaluates all of them and write down the new information. The college tutor, a consultant responsible for delivering a college training program. I mean, the college tutor is the one who's going to decide who gets into the foundation program, okay? Very important person. The clinical trainer, as we were checking, is the one who ensures that you are receiving all the information, you are receiving all the practice, and provides training during periods about the specific branch, right? And educational supervisor, the one who supervises all the trainees program, okay? If there's a very huge problem, you have to go to the supervisor and correct it as fast as you can. Well, medical qualification, this is just information slide. You can check in England, in France. You have all of these abbreviations. Just for, well, as an extra slide for you in order to consider the situation, okay? And the overseas doctor, I mean, all the steps you have to follow in order to get all the registrations. It's an example from UK, okay? When you get graduated, you receive a provisional registration. You only have the chance to work in UK, no more place. Then you get the full registration. I mean, you get, when you finish the med school, you get your register, and then you want to improve, you become into the foundation program and get the full registration. I mean, you completed the 2 years training. Then you got limited registration. International medical graduates who have not completed the equivalent of a year's clinical training in UK. This limited registration only allows you to work in a specific place. Just one, no more. The specialist registration, when you get all of your papers done, everything is clear for you. I mean, and you have the chance to work in many places, different from the country that is giving you the title. Okay. Well, the PLAB is just a specific capability for UK doctors when you are foreigner, when you are not from there, and you have to demonstrate that you are ready in level in language for getting a great contact with your patients, with native. And please come and carry on. Okay. So this presentation, I mean, it's not too long, but it has lots of definitions, of specific vocabulary. So let's keep on practicing and reading. And don't forget that tomorrow is our final test. And this is the moment to ask any detail about it. Tell me, Laura, you raised your hand.
Teacher, I have a question. Is the test going to be through a Google form, or is it going to be like a document, or like the homeworks to fulfill or something like that?
Yes, that's a good question. The test is going to be similar to the homework file. I mean, I send you a file, you download it, and you have the chance to print and fill it, or if you prefer, you just send me answers. There is no trouble on this.
Okay, thank you.
Oh, okay, you're welcome. Not a Google form because it's easy to cheat on this. I tell you by experience. That's why I prefer to send you the file. You write down by hand everything and send me back your answer similar to the homework file in a PDF. The test is going to last 2 hours, no more than that, because it's an institution requirement. But well, I cannot do anything about it. Then what else? It's gonna start at 8 p.m. and the same as the theoretical class, but we are not going to wait for classmates. 8 p.m. I send the test and you have until 2 hours to finish this. If you come late, of course, I have a second form of the test to the ones who get in too late. If you come late, of course, you have less time. You are not going to stay and complete 2 hours. It's not possible to do it. Okay. Maybe another question. You have the material to study. If you were coming to the classes, you have the slides, you have the homework files. I really want to apologize because I sent the key answers from homeworks 1, 2, and 3 late, but I think it was enough time for studying. But now, well, you got the information. That's all, I think. Let me take attendance in order to show who were here. Please fill the pool. Can you all watch the pool? Hello. Please let me know by a message that you feel the pool. And well.
Yes, teacher.
Okay. Pablo, Laura, Alejandro. Pablo, okay, thank you.
Yes, I got it.
Great, thank you so much. Maybe another question about the test, another detail you want to consider. Okay, Laura. Jimena, can you watch the pool?
Miss, I can't send the pool because from my cell phone it doesn't work.
Okay, don't worry. I got the solution
think-
with the academical
have-
supervisor and your attendance is done. Don't worry about it, okay?
Thank you, Miss. Miss, please can you send us the material, please, to study, in order to study for tomorrow?
I mean, let me ask you, which material specifically?
Everything, every class that we did, the slides, that
No.
material, please.
No, it's not
Impossible?
possible. No, because that's a rule that I got for you at the beginning. You can receive the slides if you get into the class. It's gonna be unfair from people that were asking for not attending classes, but they wanted to receive the material by free. And I said no.
Okay, okay, thank you, Miss.
Okay, I'm sorry. Try to check the
Oh.
videos. All of them are into the WhatsApp channel. I mean, you get into the WhatsApp group and go to the description. There is a link to get into the YouTube records. Maybe they could be useful for you.
Perfect, thank you, Miss.
Okay, Jimena. So go for reading. Don't forget that tonight is the deadline. I got some homework files, thank you. But tonight, well, I need to receive the files and finish checking homeworks and prepare scores. As soon as you finish your test, I'm gonna start taking scores with them, because I have to send the information who passed or who not, the final test, and in general the module 1. As I told at the beginning, every homework file, the attendance, every material, every file that I send to you and you work on is a step to reach a better score. If you didn't send me homework files 1, 2, and 3, anyway, tonight I'm not gonna receive any one of them, just the 4 and 5 file. Okay, you got all the information for that, and I think it's possible to make it. So I think that's all from me, and there is no more to say.
Miss, where can we send you the exam? Your inbox? Your WhatsApp?
I'm sorry, I couldn't understand you. Can you tell me again?
Where can we send you the exam when we finish?
No, we stay during the Zoom call 2 hours with the camera open. Well, I'm gonna send all the rules to the group now. And
Okay.
you have just these 2 hours to finish the test and send me back the answers at that moment. Okay? Everything has to be tomorrow night. For example, if we finish the test and then the 2 hours are not enough because it's too much information, you really need more time, you have to tell me as soon as it's possible during the test, not at the end, because, well, it's not the way of working, okay?
Okay, Miss.
Yes, it's possible to do it. It's not so hard. It's similar to the homework files. Has some exercises that you were developing in homework files, so it's possible to make. Don't worry about it. You are ready. Just keep on reading, keep on practicing. Catch the details that I'm showing you as important details. For example, there's some important meanings in these last presentations are details that, of course, are into the test. Definitions, well, the slides with the blue guy, some of them with anatomical review, of course. So let's take it in count, okay?
Okay.
Okay, Jimena. I think everything is set, so let's go for reading. And have a great night and see you tomorrow, okay?
Okay, have a nice night.
Okay, bye. Bye-bye.
Bye, Miss.
Bye-bye.
Bye. Bye-bye, Pablo.
Bye, teachers. Thank you.
Bye, Laura. Thank you. Bye, Dorian. Okay.